You'd recall this bold statement by women fed up with the scourge of gender-based violence. Leading industry experts say while that pandemic continues and remains a vulnerability for women and children, it must be addressed combined with the HIV and AIDS pandemic.
These epidemics are not separate struggles, but they are deeply intertwined, fueled by the same structural inequities, cultural norms, and systemic failures. While South Africa has made strides in dealing with both GBV and HIV, it is evident that our efforts cannot remain in silos. The intersection between the two epidemics demands a combined approach. One that is proactive, integrated, and rooted in collaboration across government, private sector, NGOs, global development partners, civil society, and the likes. We must acknowledge that the same vulnerabilities that expose women and girls to HIV also make them susceptible to violence. Addressing one without the other is not sufficient. In addition, we face unprecedented geopolitical challenges that threaten to reverse the progress that we've already made on both epidemics. As most of you are aware of the PEPFAR funding freeze, which has left gaps that necessitate us to shift our approaches and our thinking. This moment actually calls for introspection. We cannot rely solely on international aid to sustain our interventions.
Other organizations give chilling details of the intersection of HIV and GBV.
Women who have experienced GBV are 1.5 times more likely to acquire HIV. And this association is something that we've known for a while, that there is an association between IPV and HIV infections. We also know that approximately 30% of women with HIV globally have experienced some form of GBV in their lifetime. And one of the risk factors for HIV is sexual violence that remains high, and women experience it in a context that is also very violent communities, high rates of violence within communities. We also know that women who've experienced emotional trauma can also be affected in that it affects your autonomy and your ability to make health decisions. And finally, one cannot talk about GBV and HIV without talking about unequal power relations between men and women that make it very difficult for them to negotiate safe sex and use of condoms within their relationships.
And these could be some of the possible solutions.
We need to work towards early identification of trauma in HIV. We also need to integrate our research. We need to combine HIV and GBV. We need to look at gender equality and education and also legal protections. Next slide. And lastly, in terms of recommendations, we need to implement community-based interventions that are dealing with access, change gender norms, strengthen coordination, but also look at law enforcement as one important component of what we need to do.
The survivors of abuse, particularly sexual abuse, are at a higher rate and risk of contracting HIV, and there's often insufficient collaboration between child protection services and healthcare providers. And I think this is something that is really, really needing urgent attention. Secondly, the inadequate trauma-informed care, where children who have experienced abuse often face not only psychological, emotional, and physical trauma. These healthcare providers actually do not have adequate training in trauma-informed care, and child protection services may not always prioritize mental health as a part of a survivor-centered approach.
Crisalda Lewis, SABC News in Johannesburg.